Have you ever considered the impact of your menopausal transition on your dental health? It's possibly bigger than you anticipated. Stay tuned and I'll explain all. You're listening to Menopausenaturalsolutions. This is episode 150, Oral Health and Your Menopausal Transition. Welcome to Menopausenaturalsolutions, your podcast for all things perimenopause, menopause and beyond. Stay tuned as your host, Naturopath Jennifer Harrington, explains how to use natural therapies to find your ultimate health and happiness during your transition. Welcome and thank you for your company. Today we are chatting about all things oral health. I have touched on this previously in episode number 67, Burning Mouth Syndrome and Menopause, but today I want to dive deeper. Before I get started, I wanted to let you know I'm currently onboarding new patients, so if you've ever considered working with me to help optimize your menopausal experience, now is the time. It was a discovery of a recently published literature review titled Menopause, Skin and Common Dermatoses, Part 4, Oral Disorders, that triggered my desire to chat with you today about oral health. Never before have I seen the link between oral health and menopause so clearly defined. In case you're a research nerd like myself, I've added a link to the study in the show notes. The review touched on three main areas of concern, including bone loss, lowered production of saliva, and thinning of the oral mucosa. You may have previously considered the role of estrogen in your bone health. Hopefully you're taking proactive steps to keep your structural bones strong. But have you considered what may happen if you lose bone density in your jaw? In your jaw, we have a thick ridge of bone called the alveolar bone, and its job is to hold your teeth. In the literature review, they discussed how changing levels of estrogen with menopause can promote the loss of this bone. This can also promote periodontal disease, which may lead to tooth loss, and nobody wants that. Just as I would suggest strength training for your structural bones, consider how often you are chewing. And I mean really chewing your food, as this is the equivalent of strength training for your jaw. Hard, dense foods like chewing on a raw carrot or chomping on a crisp apple can help improve the density of your jaw bones. Did you know the oral and vaginal mucous membrane structure is similar? Just as we can experience vaginal dryness, we can also experience dry mouth at this stage of life. It is thought that up to 40% of women transitioning into menopause may experience this. A fun fact for you is that in fertile women, the saliva produces a fern pattern that mirrors the vaginal mucus changes with approaching ovulation, and saliva samples can be used as a way to predict fertility. Maybe Baby is an example of this kind of fertility test. Knowing that the oral cavity and the vaginal cavity mirror each other's fluid secretion, it's not surprising to see an increase in dry mouth at this stage of life. But it's not just the quantity of saliva that changes. It's also the composition, the microbiome, and the pH. These salivary changes can impact oral health in many ways. It can predispose a woman to plaque, oral infections, taste disturbances, difficulty swallowing, and periodontitis. As digestion starts in the mouth, it can also be reduced by the absence of adequate saliva. But menopause isn't the only reason why midlife women can get dry mouth. Some medications can cause it. Some foods can too. Just think about how you feel after a particularly salty snack. alcohol and smoking are other major causes. Then again, your dry mouth could be due to the presence of another underlying health condition such as sleep apnea, Sjogren's, diabetes, and the list goes on. Then there is a condition called menopausal gingivostomatous. This refers to a pale-looking, fragile mucosa that is easily damaged and bleeds readily. Ouch! If this is you, please seek professional help. Here are a handful of my favorite nutrient considerations. All of the fat-soluble vitamins. Vitamin A, D, E, K, CoQ10, and hyaluronic acid. I think this may be the first time I've mentioned hyaluronic acid on the podcast, so I'll briefly explain it now, but I've added it to the long list of topics I want to discuss with you in the future. It is a hydrating, cell-renewing, anti-inflammatory, and antibacterial nutrient. It's mostly used in the skincare industry, but its use is rapidly expanding. In regard to dentistry, some dentists will inject it directly into your gums. Some may recommend a mouthwash or a topical gel to apply yourself. It's used to help regenerate the tissue in your gums. It reduces inflammation, reduces the risk of infection, and decreases bleeding while assisting in wound healing. I know this hasn't been a fun conversation, but the moral of the story is to stay on top of your dental health. And this starts with a trip to the dentist, as prevention is 100 times better than trying to correct the problem afterwards. If we were to consider a diet for dental health, it would be one high in crunchy, chewable fruits and vegetables. It would be high in beneficial natural fats and fat-soluble nutrients. It would also include a lot of protein and collagen sources like slow-cooked meats and bone broth. Fermented foods to boost probiotics are another good idea. On the other hand, it would be very low in sugary processed foods and in processed dangerous vegetable oils. The key nutrients I would include are all of your fat-soluble vitamins. As I mentioned before, this is vitamin A, vitamin E, vitamin D, vitamin K. Important minerals like calcium, magnesium, potassium, and zinc. Then there is oil pulling, an ancient Ayurvedic practice. Have you tried it? It involves placing 1 tablespoon of oil into your mouth. Coconut is the most frequently used oil, but you can also use sesame oil. Pull the oil through your teeth and swish it around your mouth for about 10 minutes. When you are finished, spit it into an old tin or jar. Do not spit it down the sink. Remember that coconut oil is solid at room temperature, and you don't want to block the drain and have to call the plumber. Then clean your teeth as normal afterwards. Teeth cleaning should include flossing, brushing, and tongue scraping as a bare minimum. I can't encourage you enough to look after your oral health. Your mouth is so much more than just your smile. You may not realize it, but the health of your mouth impacts your entire body. There are over 50 health conditions linked with poor oral health. I think I've already scared you enough today to list them all out. Just know health isn't segmented. Everything works together, and a weakness in one area impacts other areas. A good example of this is menopause. I bet you never considered that your menopausal transition could impact so heavily on your oral health until today. As I mentioned at the beginning, I'm currently onboarding new patients. So if you need a hand and would like to work with me, now is the time. Thank you for your company, and I look forward to expanding your awareness of the menopausal transition again next week. Until then, Bye for now. Thank you for listening to Menopause Natural Solutions. This podcast contains general information about menopause. It is provided as a guide, and it is not intended to replace medical advice. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. If you have enjoyed today's episode, please share it with a friend.